Good morning, or should I say good afternoon actually. It is 12:42 Eastern Time here on the East Coast. And in Wuhan, China, the time is 1:42. They're actually into their next day. It's Friday for them there in Wuhan. We're going to talk about coronavirus, okay? We're going to talk about its spread. I have my live coronavirus map tracking these cases throughout the world. This is a worldwide health issue. Not my words, the words of the World Health Organization, okay? We're going to talk about what we're seeing in the mainstream news media. We're going to talk about what's not being seen in the mainstream news, but they won't show you, or what is being censored by the Chinese government because they are a socialist republic, the Chinese government. They can control the information going in and out of their country. And we're also going to talk about a little bit about what's going to happen going forward. You'll notice I don't have my aluminum foil hat on yet, so the Chinese government can track me if they wanted to. I also ate Panda Express today. I don't know if that's going to increase my chance of getting coronavirus. Jokes aside, let's get into it. Confirmed cases, 9,776 confirmed cases. It's as of a few hours ago. You'll recall the last confirmed case number amount was about 6,900. Significant jump from the last reported case number. Total deaths now over 200. A majority of the deaths are going to be in China. If not all of the deaths, the entire death count does include pretty much all cases in China. No deaths outside of China yet correlated to coronavirus. Another important number they're not talking about, the total number of people who have recovered from coronavirus. Yes, there are recoveries of coronavirus. You can get better. It's not a death sentence for you to get coronavirus, okay? But almost 200 have recovered, and it is mostly young individuals with a good immune system, okay? You can get better from this. Let's move on. Let's talk about the United States. 6 confirmed cases in the United States with human-to-human transfer, okay? Husband and wife combo got this. The wife went to China, came back, gave it to her husband, okay? That's important because the majority of the cases were individuals who traveled to China and came to the U.S. and brought with them coronavirus. All of these individuals are in hospitals now being held under observation, okay? You've probably seen the countries that have taken their citizens out of Wuhan, China. You'll know that the city is under lockdown. You can see videos and footage of the city barren, desolate. Nobody's on the street. Nobody is driving their car around. People are in their apartments, in their homes. They're staying there, okay? Unless they need to go to the hospital. And we'll talk about those hospitals in Wuhan. Very important. In the case of the United States, we've taken about 200 individuals, U.S. citizens, out of Wuhan on a flight. Most of them are consulate personnel. Some of them are standard citizens who are living there. Really important, what they didn't talk about too much in the news, those people are not currently under quarantine. They were flown back. They had their fever scan done. They were not required to go into quarantine. They're out in the public now. Of course, if one person begins to show symptoms of coronavirus, the entire flight will be brought back into a mandatory quarantine. But as of right now, those 200 individuals are out doing whatever they do, interacting with whoever they may interact with. So, a little risky there, if you ask me, but they know what they're doing. Again, World Health Organization ruled coronavirus as a global health concern. Okay, that means it's going to be far-reaching, and it already is far-reaching. We're seeing cases all throughout Europe, all throughout Asia, and in the Americas, Central America, North America. Okay, that's what we're seeing in the news. That's what regular news media is showing us. Let's talk about what we haven't seen and what you can see yourself with a little bit of research. We're not seeing the overcrowded hospitals. We're not seeing the overworked medical personnel. We're not seeing, get ready for this, people collapsing in the streets of Wuhan and in other Asian countries. I didn't see it till I had to look it up, okay? A lot of information is being underreported or misreported. Okay, I'm willing to bet you the current confirmed case number is in the 10,000s right now as we speak, if not 11,000, 12,000, 13,000. And we're probably going to get there with the next confirmed case report. And I'll tell you why. What they're not telling you in the mainstream news. Test kits are not readily available in a lot of these hospitals. Wuhan has a population in the millions. I know it's under 10 million. And they've only been given about 10 to 50,000 test kits, not enough for the entire population. So we at this time truly do not know how many people have this illness. They're only giving test kits to those with severe symptoms, okay? So if I present at the hospital with some light coughing and sneezing and I have coronavirus, it's only going to get worse, and that's when I'll get my test kit, okay? We're not cutting it off at the source, okay? That's important to know. Many people are being quarantined inside of their home. You're not going to see the footage of that on the news. You can see it online. The Chinese police have forcibly barricaded people into their apartments. They put up metal bars so these people cannot open their doors and leave because they are suspected of having coronavirus. Footage in the hospitals show packed hallways, people on CPAP, which is to help you breathe better when you're on pneumonia, people on oxygen. Guys, it's bad. That's why they're building these hospitals out in Wuhan. They're rapidly building them because they don't have enough beds. They have a great number of personnel, but not enough beds. Okay. Again, you can see all this online. People, unconfirmed footage, but it's footage inside Wuhan hospitals, Chinese hospitals. Dead bodies in the hallways, people dead and dying in the waiting rooms. Very scary. Okay. There's a gentleman who is in Wuhan right now, where a lot of this footage is coming from. He went into the hospitals, and filmed whatever he could. Talking to patients, talking to the construction workers at the construction site for the new Wuhan hospitals, okay? And he's showing us that the personnel are being overrun, the structures are being overrun, people are collapsing, literally falling to the ground in Wuhan and other Asian countries. It's unknown whether it's correlated to coronavirus, but it's happening and it's being captured on film. And when you see these collapsed individuals being treated, they're being treated by individuals in full hazmat gear. That's not standard EMS operating procedure, I can assure you. So we don't know the full extent of coronavirus. Let's talk about the long-term stuff now. We don't know what's going to happen in the long run. It's still very early. What we know, cases are spreading mostly in China and to other countries at a rate faster than SARS, faster than MERS, Middle Eastern Respiratory Syndrome. Okay. Is the spread as great as the flu? No, because the flu has been around for a long time. Coronavirus, we've only been following it for under a month. So, are the numbers going to grow? Yes. I think they're mostly going to grow in China and in other densely populated countries with poor health care. We have cases in India. If the cases in India take off, forget about it. That's going to be huge. Other important things, the spread, while far-reaching, we have cases in the U.S., it's not rapidly spreading in the U.S., okay? It seems to be almost contained in the U.S., right? Because we have such good health care. We'll have to follow that closely, though. Things could change. Again, we have unquarantined citizens who were in China, in Wuhan, walking around the streets. So we'll have to see. They're gonna trace contact by those who have symptoms or have been confirmed to have coronavirus. So if I have coronavirus here in the U.S., I start showing symptoms. They're going to ask me where I've been in the past 2 weeks, who I've been in contact with, bathrooms I've been in, rooms I've been in, the room I'm in now. They're going to find those places. They're going to find the people who came into contact with it and try to stop the spread of coronavirus. Again, long run, it's still early to tell. It's still very early. We know vaccines are being researched now, which could take, at a minimum, a year to implement, to figure out what the vaccine is, to produce it, and to distribute it. And even then, if at its fastest, we won't know what the side effects of this vaccine are. Is it going to get people cancer? Is it going to cause other health issues? Okay, very serious. It's a good thing they've declared this a world health emergency. I think it is a world health emergency. Again, here in the U.S., not too much of a problem yet, but it can be. It definitely can be. What people should be doing now is researching how to stop the spread of disease. Hand washing is the best way to curb the spread of disease. Don't touch your face, don't touch your eyes, don't touch your mouth, don't touch your nose. Just don't stand too close to people, don't shake hands, don't talk face to face with somebody, okay? I think this will resolve itself in time with the hard work of health professionals, but we'll have to see. All right. Again, it's a waiting game. We don't have any definitive answers yet. We're still figuring things out. China is still figuring things out. And expect more cases to come. Expect more countries to be infected. And, stay safe and stay clean. All right? I'll see you in the next one.